Thank you, Doctor. Thank you, Dr. M.K. Sahani, and thank you, Dr. Manoj. And now it's the time to start the international session. Today is the 1751st day of uninterrupted webinar of IFPH. Before beginning the session, let's have a silent prayer. Hello, doctors, friends of homeopathy, and students of homeopathy. Today is the 1751st day of uninterrupted daily webinar of IFPH, and our guest speaker is Dr. Krishna Parikh, Associate Professor, Department of Obstetrics and Gynecology, Sri Mahalakshmiji Mahila Homeopathic Medical College. She possesses a strong foundation in homeopathic principles, and along with that, she do have that expertise in obstetrics and gynecology. Dr. Krishna Parikh, her commitment to holistic healthcare is further enriched by her qualifications in naturopathy and yoga. And today, the topic is post-delivery problems of females and its homeopathic treatments. Let's welcome Dr. Krishna Parikh for the session. I welcome you all for the session.
Today I would like to share the postpartum problems related to females. So there is post-delivery problems related to females and its homeopathic management. This is the today's my topic to discuss. So what can be the problems? First of all, we move towards the definition of the postpartum problems. That is the postpartum problems in female. That is the refer to a range of physical or mental health issues which can arise in the postpartum period, which is the time after the childbirth. We can say we know that about the time after the childbirth, mother faces the lots of problem, whether it may be physical or it may be some emotional problems. So, if we will move further, the physical problems. What can be the emotional problems? There may be bleeding per vaginum, excessive bleeding, hemorrhage is there. Sometimes you can say it may be lochia or it may be vaginal discharge. Sometimes it occurs. A patient may suffers from some infection, or you can say there might be puerperal period or puerperal sepsis or puerperal septicemia. Sometimes it happens. Patient may suffer from any other perineal pain because of some episiotomy, because of some episiotomy like symptoms or any other injury uh, or any other pain. That is the perineal pain which occurs to the patient, or sometimes there may be LSCS pain, lower segments. Sometimes the female may suffer from constipation, or she may suffer from the hemorrhoids like complaint, piles like complaint. As we all know, constipation leads to the hemorrhoids, and that is much more common in during the pregnancy state rather than post delivery. So, during the pregnancy state, as we know, the pressure of the gravid uterus or effect of the progesterone on the bowels or effects of the this uh, motility of the intestine becomes very less, which can lead to the condition like the constipation. And because of the pressure of the gravid uterus on the anal region, which can lead to the engorgement and leads to the hemorrhoids. Then another physical complaint, that is the breast problem. Female may suffer either during the lactation period, excessive milk is there, very scanty milk production is there, or there might be some infection or retracted nipples, like nipples may be cracked and sore, or dryness, or any other mastitis like problem, which can lead this. That is very common, I feel, very common symptoms during the puerperial time. Then what I come across during the puerperium, the patient comes with the hair loss, hair fall. That is the most common complaint of the female, that is the hair fall. Then As the uterus comes normal to the position after the childbirth, patient may feel the contraction toward the lower pelvic region, uterine region, that is the after pain. One more another common problem to the female, that is the urinary problems. Urinary problems, it may be retention of the urine, or it may be involuntary passage of the urine. If there is retention of the urine, there is any kind of the any nerve damage, vaginal delivery, if there is any nerve damage occurs, then it can lead to the retention of the urine. But such problems are like it may resolve on its own after certain weeks or after certain months. Then pain in the joints, bones, muscle, ligaments, lower back pain, which is very common into the puparium period, or at the time of the delivery period, or at the time of the pregnancy period as well. So these are the physical complaints or physical symptoms related to the post delivery. Then one more aspect, that is the emotional symptoms. Emotional is that is the baby blues. Patient may suffer from the postpartum depression, postpartum anxiety is there. She may suffer from some sleep deprivation or may have some mood swings. So different types of the emotional level upset, which is she can suffer or she can face after the postpartum. Then, warning signs which seek some medical advice or medical attention. That is, if there is any severe headache or dizziness or any kind of the any vision changes, then patient requires immediate medical supervision. Fever which is 100, 101, 102 or much more higher, not more, what I feel, it may be higher, then it requires some immediate medical attention. Heavy bleeding after giving birth, then postpartum preeclampsia, postpartum cardiomyopathy, deep vein thrombosis or pulmonary embolism. Patient may suffer from some breathing problem or shortness of breath. Patient may suffer from convulsion or tiredness which doesn't get better with the rest. In all such circumstances, one should go for the immediate medical attention or immediate medical care. That is the emergency. Now, if we will move for the symptoms, breast engorgement, vaginal discharge, uterine involution, soreness in the perineum, weight loss may be there, excessive perspiration or excessive, patient may suffer from constipation, hair loss is there, baby blues is there, depression or anxiety. Such kind of the symptoms which requires medical care. If we will talk about the lochia, that is the postpartum bleeding, and it is the normal discharge of the blood and mucus from the uterus after the childbirth. It begins right after the delivery and continue up to the 6 weeks postpartum. It may be heavy flow, it may up to 10 to 14 days, and then the color of this flow gets changed. It may be from bright red blood, that is the menstrual blood, up to it can go up to the yellow and watery discharge. This is the change in the color of the lochia. Now, what can be the homeopathic management or the homeopathic medicines which we can give to the lochia like condition? If the lochia is offensive, if the lochia is very thin or very scanty, or any other problem related to lochia, then we can think of to give medicine. First and foremost, that is belladonna, which has hot, scanty, offensive, and sometimes suppressed lochia. Creosote, as we all know about the offensiveness and intermittent. Sickle core, it is suited to the offensive, thin, scanty, or profuse, painless lochia. which is accompanied with the prolonged bearing down pains. Colophylum, the lochia, which is prolonged, and it is useful for bloody lochia, which last too long and exhaust the patient. It seems to ooze passively from the relaxed uterine vessels. If we talk about the pulsatilla, it is useful for the lochia, which make her feel faintness, fainting attack is there. There is sudden disappearance of the milk and discharge which is remaining, scanty lochial discharge which is remaining. Nitric acid, which has acrid and offensive lochia, and trillium pendulum, that is the hemorrhagic diathesis, which has bloody lochia, and suddenly it becomes sanguineous. Now, the next symptom, that is the puerperal sepsis, which is very common, or you can say puerperal fever or postpartum sepsis, that is the serious infection to the genital tract. It can occur after childbirth, or this sepsis can occur after the miscarriage. It is defined as an infection of the reproductive organs like uterus, cervix, vagina, and it occurs into the time frame after the childbirth or after the miscarriage. Now, important point related to the puerperal sepsis, it typically occurs within the 42 days of the childbirth or miscarriage. The symptoms, it may include fever, pelvic pain, abdominal abnormal vaginal discharge, and foul smelling discharge. It can cause to the any organism which has involved the reproductive tract or genital tract after childbirth or miscarriage. It can be mild to severe, and it can lead to the septic shock if it is very severe. If it has not taken care of in the initial stage, it can lead to the septic shock. Early diagnosis and treatment are crucial to prevent any kind of the any serious complications. Now, what are the homeopathic remedies which we can think of? There are few remedies which I have taken. The list is very long, but the most indicated key remedies, that is the 5 remedies I have listed, that the first one according to me, that is the pyrogenum, that is highly indicated for septic state with intense restlessness, septic fever, and especially puerperal fever, in which the pyrogenum is prescribed, or pyrogenum is the first rank remedy to indicated. It is also known as the homeopathic dynamic antiseptic, indicated in the condition like puerperal peritonitis, septic puerperal infection, septicemia, which is following the abortion. All the discharges are horribly offensive, whether it is the menstrual discharge, lochial discharge, sweating, or breath. Any kind of the any infection in the pyrogenum, it is very offensive and it is much more indicated. Then next one, that is the baptisia. Baptisia is also indicated for this conditions, septic condition of the blood, and extreme prostration. There is threatened miscarriage from mental depression, shock, low fevers, etc. like conditions in which we can think of baptisia. Lochia, which is acrid, fatigue, and it is also indicated for puerperal fever. Then one more medicine, that is echinacea angustifolia. Echinacea has symptoms of the blood poisoning, blood dyscrasia. That is the main keynote symptom of the echinacea. That is the septic condition generally indicated for puerperal infection, that is puerperal septicemia. Discharges are suppressed, abdomen tympanitic, offensive, excoriating leukorrhea, and here there is chilliness with nausea. In belladonna-like condition or belladonna-like patient, one more important thing, that there is no thirst with fever. Lochia is very offensive, and there is diminished lochia, high feverish state with the absence of toxemia. One can think initial stage, first stage of the inflammation, when we can think of the belladonna. Burning, pungent, and steaming heat is there. Okay, then hemorrhage has the hot gushish of the blood. Now, one more indicated remedy, that is the arsenic alb. Arsenic alb, which is indicated for septic fevers. High temperature is there. Periodicity is marked with adynamia. Patient is so much exhausted and patient has no ability to do any work. That is the condition like adynamia. Paroxysm incomplete with marked exhaustion. These are the indicated remedies related with the puerperal septicemia. Okay. Then one more important condition, that is the perineal pain. Perineal pain after delivery or postpartum perineal pain. It is the very common experience for the female who have vaginal births. It can be range from mild to very severe and often associated with the perineal trauma such as tearing or an episiotomy. While some pain is expected as perineal heals, persistent or severe pain, it may require some medical attention. Now, perineal trauma, there may be tear, episiotomy, which has given, and most commonly, this episiotomy, which is given to the primie. And primie, there she may suffer from some perineal pain after the delivery. Episiotomy stitches are taken, but sometimes it happens that stitches were not taken properly or internal bleeding may be there. So condition like hematoma may also arise. Sometimes there may be some organism involvement is there into the stitches. So inflammation can occur. Response to the injury can cause the swelling and pain. Sometimes there may be pain because of the hemorrhoids. Sometimes there may be pain because of the pudendal nerve entrapment. Inflammation or entrapment of the pudendal nerve can cause nerve pain in the perineal area. Infection into the perineal wound, which can lead to the severe pain and which can lead to the swelling. These are the basic information related to the perineal pain. Now, what are the homeopathic medicine related to the perineal pain? First and foremost, which I used, that is the Arnica montana, injury remedy, commonly used for the bruising and can aid into the healing the perineum and other tissues after birth. It can also be used for after pains and uterine cramping that can occur with the nursing. One more important remedy, that is Balis perennis. This homeopathic remedy, it can be used in the postpartum to treat abdominal symptoms. It too can be helpful for bruising and tissues injuries which is related to the birth, as well as indicated for after pains. It can also support healing after a tear. It may help women who have had cesarean section. Now, one more important remedy, that is the calendula, and that is the calendula ointment, which is very useful to heal the stitches which is taken after this episiotomy or any kind of the any surgical procedure. If the stitches are taken, and this calendula gives very effective results related to this and wound healing. If we will move further, after perineal pain, that is the complaints related with the breast. postpartum females may have breast complaints. They are very common. It can include the breast engorgement, soreness, cracked nipples, plugged ducts, mastitis. According to the various research articles, these issues are often related to the changes in the hormonal levels and milk production, as well as baby's feeding habit. If we are talking about breast engorgement, this occurs when breast becomes swollen and painful due to increased flow of blood and lymph. It's a common experience, particularly in the first few days of the postpartum as milk production increases. Sore or cracked nipple. Nipple pain and cracking are frequent, often used by improper or incorrect feeding technique. They can be painful and potentially it can lead to the infection. If a mother is giving frequent breastfeeding or baby is opt for the frequent breastfeeding, then also mother may get the condition like mastitis. Mastitis, which is an infection of the breast and typically caused by blocked ducts and bacterial infection, it can cause pain, fever, and flu-like symptoms. If there is plugged ducts, milk is not adequately removed from the breast during feeding. It can lead to the build-up inside and causes blockage into the ducts. This can cause pain, swelling, and even mastitis. In some cases, mother may experience difficulty in producing enough milk to meet their baby's need. At that time also, she may suffer from the breast problem or like a galaxia like problem. Breast abscess, serious complication where an infection results into pocket of pus into the breast, which can lead to the condition like breast abscess. Now, what are the homeopathic remedies which we use to solve these problems? First of all, pulsatilla. It's a very effective homeopathic medicine which is prescribed in the case where the flow of milk is completely absent or scanty in mother. Mother may also complain of swollen breast that are painful to touch. She may also suffer from depression and urge to cry frequently. One more important homeopathic medicine for the for the milk production, that is Ricinus communis. This homeopathic remedy, which helps increase the production and flow of breast milk in nursing women. This medication is usually prescribed in a low potency for such a condition. Then, one more important medicine, mastitis like condition. Two important remedies are there. One is phytolacca and another one that is the Bryonia alba. Phytolacca, it is helpful for issuing or arising the breastfeeding, including engorgement, painful nipples, and plugged ducts. Bryonia alba, which has history of pain in the breast at the menstrual period. When she is menstruating, she has pain into the breast, which history is given by the female and also indicated for the milk fever. Breast which is hot, painful, hard, as well as sometimes there may be some abscess into the breast region. Now, one more important topic, that is the urinary problem which occurs after the delivery. Now, after delivery, the urinary problem, it may be incontinence of the urine. Sometimes there may be retention of the urine, or sometimes urinary tract infections, which are very common. due to changes in the pelvic floor muscle. There may be nerve damage, there may be trauma during childbirth. Sometimes it happens epidural anesthesia which is given, which can also lead to some nerve damages, temporary basis per. At that time also, patient may suffer from some urinary complaints. These issues, which can range from mild discomfort to significant interference with daily life and may require medical intervention for the long term relief. Now, which are the common urinary problems after delivery? So, there may be involuntary leakage of the urine, often due to weakened pelvic floor muscles supporting the bladder. This can occur during coughing, laughing, or exercise. Involuntary leakage of the urine, which can occur because of some forceful efforts which made, and because of this forceful efforts, she may complain that she is passing some involuntary urination. Previously this kind of the thing doesn't happen with her, so she feel very much uncomfortable with this such kind of the symptoms, so she requires some medical care. Postpartum urinary retention, all these things because of the anesthesia, local anesthesia also, nerve damage temporarily, and because of all these things, difficulty in emptying the bladder completely, sometimes resulting in the need for the catheterization. This can cause increased pressure on the kidney, leading to potential complications. But if the patient is unable to pass urine at least 6 hours after delivery, then one can label that patient is having retention of the urine after labor. If the retention is there and patient has no urge, and if we can palpate onto the lower pelvic region, we found there is urine retention, then one go for the catheterization. If long term retention is there, it is possibility that organism can involve that region, so bacteria and organisms can enter through, and then it can lead to any kind of the any infection which can spread from the bladder up to the kidney. So, this infection, which can cause by bacteria, which can lead to painful or frequent urination, and sometimes it can lead to the fever. Now, what are the homeopathic intervention or homeopathic treatment related to this? First and foremost, medicine, that is the arnica. Retention is the main urinary symptom of arnica. Retention from the perineal injury or from overexertion. Vesical tenesmus with very painful micturition. Bruised parts after labor and violent after pains. So arnica has important injury-like symptoms, and because of that, bruise filling is there. So we can think of arnica. One more important remedy, that is causticum. Causticum has retention of urine after a long labor or after any surgical procedure. If there is any retention, we can think of causticum. As we know, causticum is for the paralysis like condition. So there is any loss of sensibility or prolapse like condition of the bladder after accouchement, after delivery, then we also think of the causticum. There is loss of sensibility after or on passing urine. Retention of urine, which is after accouchment. Prolapse of the bladder, that is the important symptom of the causticum. Prolapse of the bladder after accouchment. There is frequent, painful, and difficult urination. Burning in the urethra, which is after urinating. These are the symptoms of the causticum. One more important, that is aconite napellus. In the aconite, the renal region is very sensitive. Tenesmus and burning at the neck of bladder, burning in the urethra, urine which is suppressed, bloody, and difficulty in passing urine. Here there is retention with screaming and restlessness. So these are the main remedies related with the urinary complaints. Okay, if we will move further, if there is UTI like complaint, we can think of the cantharis, then Chimaphila umbellata, then Sarsaparilla. These are the also remedies we can think at the time of the urinary tract infection. Then emotional problems. Emotional problems, they are the major attention if mother is suffering from any depression, any mood swing or psychological problem, or mother previously she had history of any psychological treatment, then it is very urgent care for that particular mother, urgent care which is required. In post pregnancy, new parents can experience a range of emotional challenges, from the common baby blues to more serious conditions like postpartum depression and, in rare cases, postpartum psychosis. Understanding the difference between these conditions and seeking appropriate support, which is crucial for both the parents and baby's well-being. What are the baby blues? I came across this baby blues, this word, very frequently. So, baby blues, the symptoms which are characterized by mood swing, anxiety, sadness, irritability, and tearfulness, typically occurring in the first couple of weeks after delivery. Now, this problem, as they have become the new parent and they don't know how to handle the baby, then this kind of the symptoms, they are very common, but this kind of the symptom which goes away within few weeks. But if it doesn't resolve within few weeks, then there is some specific treatment which is required. Baby blues, this kind of the symptoms which doesn't significantly impair the daily functioning or the ability to take care of the baby. They are just anxiety related with the mother's health, or anxiety related with the baby, or there is excessive amount of the worries regarding the baby, then it will be termed it as baby blues. Now, what are the homeopathic medicine? We have very good medicine related with the depression or psychological care or psychological impact. First, that is the natrum mure. This remedy can be helpful when a woman is experiencing the feelings of disappointment about the birth experience or overall outcome. It can help when one feels irritation at others' attempts to console them, even though they are sad. Women needing this remedy may also get headache or heart palpitation when she gets depressed. One more important remedy, that is pulsatilla. This remedy can aid women who are feeling emotionally sensitive and prone to tears in the postpartum. These women may feel needy and insecure, wanting constant affection, assurance, and nurturing. Getting fresh air and avoiding warm, stuffy rooms can help her. Finding a way to express or release the emotions in some way also greatly assistant women experiencing the heightened sensitivity in the postpartum. One more important remedy, that is the calcarea carb. It is also helpful for the overwhelming females For this female, weakness, fatigue lead to the depression, anxiety, insomnia, and nightmare. A person who needs this remedy often feels sluggish, cold, and easily tired by exercise. One more important remedy, that is the semicifuga or actia. This actia is for the emotionally and hormonally based depression. Women needing this remedy may feel a dark cloud has settled over her head, very much anxious. There might be some rat is running around her or under her chair. Anxious and low spirited, begin to believe she is incapable of caring for the baby. All the negative thoughts come into her mind. Alternatively, she may become excitable, talkative, saying and doing irrational things. So, semicifuga is there, and sepia, the indifference, which is very common after childbirth. She had lots of work to do. There are so many night watches are there, sleep which is not properly taken by her, or sleep disturbances are there, and because of all these things she experiences or she feeling has indifference, exhaustion, mood swing, and especially they feel overwhelmed and detached her to the family members. Now, some other symptoms and related to its homeopathic management. So other symptoms are constipation. Constipation, it can occur during pregnancy. Constipation can occur in the postpartum period. Patient is having very less intake of the water, or food habits which are not good, which can lead to sedentary lifestyle is there, or any other before during pregnancy. If iron tablets she is taking, which can also lead to the constipation. She is not taking the leafy vegetables, then also there is constipation. So in such condition, few medicines are there. These are the bryonia, alumina, nux vomica, platina, and lycopodium. If this constipation is severe, if she has to strain a lot, then it can lead to the hemorrhoids, or because of the pressure of the gravid uterus, then also it can lead to the venous engorgement. So, in such condition, we can think of the cholinsonia. If blood loss is there, bunch of grapes, allosocotrina. So, cholinsonia is also there, multiple hemorrhoids. Aloes is also there for the multiple hemorrhoids, but aloes has the soft stool passage. In muriatic acid, it is also very important remedy for the hemorrhoids. Touch of the napkin, which is very unbearable for the muriatic acid patient. Lachesis also has hemorrhagic diathesis, as well as bluish discoloration of the piles or of the hemorrhoids is there. Ratania is also one of the important remedy related to the hemorrhoids. As I told you previously, that hair loss, which is very common post delivery period. So sepia, if there is indifference is there, patient is having lots of menstrual irregularities, and she is suffering from the severe hair loss, then we can think of sepia. Sepia has this kind of the keynote symptom, hair loss after delivery. Then natramur and carbovage, they are also in the indicated list of the medicine. Patient is suffering from the milk fever, mastitis like complaint. Then we can think of bryonia as well as calcarea carb. So with this, I have completed my topic. Thank you very much.
Thank you, Doctor. So it's a time to interact with the speaker. It was an excellent session.
Thank you, sir.
Let me welcome persons presented who are here. presented here for the session to interact with the speaker. So with homeopathic medicines, it was a great advantage because these days, whenever this type of medicines means these allopathic medicines, intervention, uh, unwanted antibiotics, lot of chemical drugs, when the mother is lactating and feeding the child, is being drugged, is being affecting the neonatal, means the infant. So this homeopathic consultation, homeopathic treatment is a boon to the humanity, isn't it, doctor?
Yes, homeopathic medicine is very good and very much helpful to the humanity, as it is not giving any kind of the any side effects, as well as it gives just the cure to the patient. That's why I prefer homeopathy in many conditions. Whether if there is no any emergency, then we can think of the homeopathy, as we all know about all these things. If there is any emergency cardiac related problem, or severe acute renal related problem, or any deep vein thrombosis related problem, then it requires emergency medical attention to the patient.
So apart from the medical emergencies, lot of things can be done with homeopathic medicines. We got these things from our practice, daily practice. We are getting that. And can you just mention some cases which you deal? And I noticed that you have good clinical experience also with using homeopathy. Can you explain?
Sir, I had one patient related with this hair loss, and she was with me that she wanted some treatment regarding this because of the hair loss. That patient delivered just 4 5 months back, and 5 months baby with her. She is a case of the hypothyroidism as well, but she wants medicine just for the hair loss. So I prescribed Sepia 30 for this, and I got very good result with the Sepia, and her hair loss is stopped within 1 week, and she was very happy with that. One more case I would like to tell, that patient had miscarriage just 3 4 days back, and abortion was there, and she came with some feverish condition to me, and then I was think of the pyrogenum. I gave her pyrogenum, and that pyrogenum 200 I gave her, and then pyrogenum 200 gave a very good result to the patient. She had no fever. So these two cases, I think, landmark I can say in postpartum delivery period. Huh. In some urinary complaints also, I think of the arnica. Arnica is very good. I frequently prescribe arnica. Arnica in any kind of the any injury like condition, or postpartum delivery like condition. I assume patient have some injury in postpartum period. So, if there is any pain or after pain, and patient is suffering from this condition, so I straightway prescribe arnica. So, the arnica gives relief to the pain, as well as if there is any mild swelling, it also reduced with the arnica. This
Okay,
is
that's
all about.
yeah, that's great. That's great. And very curiously, I noticed that you have a qualification in naturopathy and yoga, that you
Yes,
can
sir.
incorporate a lot of things with homeopathic consultation. Can you explain a little bit more about your experiences with that?
Sir, in naturopathy and yoga, I use my this qualification as suppository treatment. Like if the patient is having any constipation like complaint, or patient is having any backache like complaint, so I advise them to do certain poses of the yoga. If there is any muscle stiffness, then I can advise for the yoga. If there is any bone related complaint, then we cannot advise, or any prolapse of disc related problem, then we cannot advise related to the yoga. Then this naturopathy, my knowledge of naturopathy which I used as a food, related to the food, what should be taken and not should be taken. So in some conditions I advise what they have to take. If they ask me कि मैडम क्या लेना चाहिए, क्या खाना चाहिए, क्या पीना चाहिए, मतलब क्या क्या ले सकते हैं, then I advise कि नहीं, you should take, you should avoid और परहेज, आपको ये चीजों का परहेज करना है, या फिर आपको इतनी इतनी चीजें तो लेनी ही है जिससे आपका मतलब लाइफस्टाइल अच्छा हो पाए. So I use my knowledge like this way. If they are asking me some mud therapy related, or they are asking me some meditation related, so this meditation is also helpful in conditions like the depression or psychosis. I frequently advise for the meditation. If the person is having very stressful life, if person is having job related stress, or a female is having stress related the family or day to day life, then I advise at least for 5 to 10 minutes at the bedtime you do the meditation, so it will reduce your stress level, which directly impact into your health. And without medication, or with the very less medication, we can gain the good results along with the homeopathic medicine.
That's great. And so now again, we have about 8 more minutes to continue. So if persons are there to interact with the speaker, they can come. They can raise their hand, that we can invite them and they can interact with the speaker. I think Dr. Sharma is here. Dr. Sharma will be glad to interact with. Here, Dr. Sridhar Kurup is here. Let me welcome Dr. Sridhar Kurup.
Ji, sir.
Yes, madam. For regarding the children, nowadays I am getting so many cases. After 2 months, 3 months, 4 months, the child is having constipation. Then I ask usually in Kerala, that the mother will take some medicine, some Ayurvedic preparations for to get more milk in the breast. Today also I got 1 or 2 cases from Ernakulam district. Then 2 months child, last 1 week there is not passing. Then first I asked that what about the mother is taking any medicine? She was taking some Ayurvedic preparation. So I told them that to first stop to the medicine. So whenever you may take the child's case, we must ask the mothers what they are taking and such things. I am sharing for the persons who are listening here. It is very useful. Always to the what about the mother's history also. It will definitely will help. Thank you. And now there is not that much time. Only 7 minutes more is there, I think so.
Doctor,
so what about your opinion? You please explain what about your experience.
Experience regarding, sir?
Regarding that to the children and their diseases, and regarding to the taking of the medicine, allopathy or Ayurvedic, some other medicines in the mother, its effect on the child, whether you got any experience of it. That is
no, sir. Recently, no, sir. I have not such experience that mother is taking any kind of the any medication. They are taking any allopathic medication, which is prescribed according to their medical condition. But I have not seen such case. The mother is taking any Ayurvedic medicine, and the child is suffering from the constipation like complaints. So I have not come across such case. Sorry, sir.
Okay. Simply I asked because I am getting.
No, I got knowledge from you, sir.
Okay, thank you. Today also I got 1 or 2 cases like that. That is why it came to my mind. That is why I asked.
So
thank you,
sir.
Doctor. Thank you. And next is Dr. Irfan with us. Dr. Irfan. Doctor, you can speak.
Yeah, thanks. Very good presentation. Knowledgeable. Constipation after delivery, medicine like colinsomnia, you should potency, lower potency.
Yes, sir. Lower potency. 30. I
Oh,
generally prefer medium potency. So I generally prescribe in 30 or 200, but I prescribe 30.
okay, okay, okay. Okay. Or like natomure, low potency advice or high potency?
So Natromure, medium 200 around potency I prescribe.
Okay. Oh, thanks, doctor. Oh.
Thank you, Dr. Irfan. And if any other person is here to interact, Dr. Rampravesh Shah, you can speak.
Thank you, Dr. Binduraji, and congratulations, Dr. Krishna Parikh.
Thank you, sir.
Excellent session
Thank
for
you, sir.
delivery in female and delivery after many kinds of symptom, many kinds of problem. So delivery after weakness and highly discharge of bleeding, China is the suited remedy. China 3x. 3x China is a very good action. And other complaint, gas, yeah, pulsatilla, highly desired fatty things. So pulsatilla is a very good remedy. So very thanks, Dr. Krishna Parikh, and colosonia constipation, very good remedy. Colosonia.